edition of the Ultimate Pulmonary Wellness webinar series. Tonight we are blessed. I have as my guest somebody who I've been reading about for many years and studying his work for many years in the pulmonary paper. His name is Ryan Diesem. I'm going to tell you a little bit about him. Mr. Ryan Diesem has over 13 years of experience with and product knowledge of home respiratory equipment, including home oxygen systems, portable and stationary oxygen concentrators, oxygen conservers and regulators, liquid oxygen, and home oxygen accessories, including CPAP and CPAP interfaces, home ventilators, and more. Ryan, along with Bob McCoy, RRT, FAARC, authored the 2007 Guide to Oxygen Conserving Devices, and Ryan has been a regular contributor to the patient-focused pulmonary paper since 2010. Hello, Celeste. Thank you for the support. We appreciate it. Working out of Apple Valley, Minnesota. Boy, that sounds nice. Apple Valley, Minnesota. Mr. McCoy and Mr. Diesem are Valley-inspired products, okay? An independent device testing and patient education entity with the goal of bringing awareness and understanding of home respiratory device performance capabilities to the forefront of home respiratory care. And what that means is that Ryan is not selling you anything, okay? What Ryan is doing, okay, with Mr. Bob McCoy is they are testing the equipment independently and telling us the scientific background behind what makes something good and what makes something bad. Before I do go on, I just want to say one thing, a disclaimer. As always, what you're about to hear are going to be my opinions and Ryan's opinions. Do not run out and say, Noah made me do it. Don't say Ryan made me do it. Don't say Sam the dog made me do it, because that's already been done. But please, anything that we talk about tonight, it's really important that you speak to your doctor about it and ask questions. We are providing information only. So without further ado, Ryan, welcome to the show.
Thank you so much for having me. I'm really excited to be a part of this and look forward to the next hour and a half or however long it's going to be here. So we got all night, baby.
Awesome. Well, I'm glad that you're here for an hour and a half, but I guess they didn't tell you there's going to be a 23-hour broadcast, but no sweat. We have plenty of Red Bull.
It's a good thing I got Mountain Dew, yeah.
Awesome. So I also want to say hello to the Ultimate Pulmonary Wellness Facebook group, and we are going to get started. So we get so many questions over and over again about what is going to be the right oxygen device for me, what is going to be the best concentrator. And there is so much confusion out there, not just amongst patients, but really, I think, amongst clinicians. And I think it's because we don't know how to interpret the data, or we hear these numbers 1, 2, 3, 4, and we think that it's the same on every device. So let's just talk a little bit, Ryan, if you don't mind. Break it down for us, basics. What are the different types of oxygen that people can use?
Well, there's only one type of oxygen. There are different types of delivery systems that they can use.
Right. So oxygen delivery systems.
So you have your stationary concentrators, which I'm sure most oxygen users have in their home. That's pretty much the most basic oxygen delivery system out there. You have your portable concentrators, which have now been around for about 12 years. Most of them have come out within the last 5 or 6. So that's kind of the product du jour of the moment. You have your old standbys, the tanks and the regulators, whether that be a continuous flow regulator or a pulse dose regulator, also called a conserving regulator. You have the liquid systems, which we definitely should talk about that. You have some other kind of devices that implement oxygen, like the NIOV. That's kind of a portable bilevel ventilator in a way that adds supplemental oxygen to it. There's quite a bit out there, so we got a lot to talk about.
All right, so let me ask you this. Let's say, for argument's sake, I go to my doctor's office and they do, some testing on me, and I guess why don't we start off with this? I guess the way that many people find out they need oxygen is they'll qualify through the 6-minute walk test. So do you want to talk about that a little bit?
Sure. The 6 minute walk test, I'm going to guess most people on oxygen have gone through. If you're not aware of it, they basically have you walk down a hall or around some area, a flat surface, for 6 minutes and measure your oxygenation. So it's measuring the amount of oxygen in your blood. And they see if the amount of oxygen in your blood decreases, what's called a desaturation. So normal people, normal healthy people, their saturations are going to be in the mid to high 90s or so. People that need oxygen, the current requirement is that you drop below 88% for a certain amount of time. The 6 minute walk test will tell you that. Do you drop below 88% blood oxygen for any amount of time in that 6 minutes? So that's kind of the standard test. But what it doesn't tell you is you don't do a 6 minute walk test at home. You don't do a 6 minute walk test when you're going to the store. A 6 minute walk test doesn't test you walking around your home, reaching up into your cupboards, reaching down into your cupboards, going into the shower, going out to your car, lifting your groceries into your car. It doesn't do any of that. So it's a very, 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 very baseline test to see if people need oxygen, but what it doesn't really test the amount of exertion that most people do on a daily basis. So it can give you a general idea, but a lot of times you might not desat in that type of environment. So if you find yourself, being short of breath and just not having the energy, and you've done a 6 minute walk test, I would definitely suggest saying to your doctor, look, I've done the 6 minute walk test, but I'm still feeling short of breath. I'm still tired. Is there any other way I can get an evaluation done, doing some other things? We can talk about oximeters here, but they do have oximeters that record what you're doing at any given time. Nanan makes what's called a wrist ox. So it's something you wear like a wristwatch, and you put the oximeter on your finger,
Yep.
and it records what you're doing. You can wear that for 24 hours, and it records everything you're doing. If you keep a log of what you're doing that day, you can cross-check and say, oh, I was going out to my car here and putting some stuff in the trunk. I desatted to 70 or 80. Some people can drop quite a bit, and they might not do that in a 6 minute walk test. So there are ways out there to see if you are desatting without necessarily having to do the 6 minute walk test.
I agree with you, and I could go on for hours about what I don't like about the 6 minute walk test. But if I'm hearing you correctly, I mean, to me the biggest issue is it doesn't take into account incline. It's so
Correct.
like, for example, how many of our patients come to us and they say, I get short of breath on stairs, I get short of breath when I walk up an incline. If I'm on flat surface, I'm fine. It's a totally temperature controlled environment and environmentally controlled, and it's patient controlled. So the bottom line is, I've actually heard patients say, you know what, don't do too good because you're not going to get it, or don't do too bad or you're not going to get rehab. I think that anytime the patient has that much control over it, and don't get me wrong, patients, please don't write me nasty letters. It's not because I don't trust you. It's because I think that we have to find a way to get the patient out of their comfort zone. And I think, if I'm understanding you correctly, you're saying that we could do a 6 minute walk test and find out or get the false negative, meaning that the patient is not showing up as hypoxic, and then we're stuck.
Right, correct. It doesn't really test the environments that the patient are in. You mentioned, if you have a home with stairs, you're going to be walking up those stairs, and a 6 minute walk test doesn't cover that. So
Right.
it'd be great, if there was, and actually there was a device out there that was developed to kind of take. I mentioned the wrist ox. It's a device that you can connect your oxygen system to, and it monitors your oxygenation, your heart rate, and all that stuff. It was called I'm going to forget the name of it.
I believe we have one here.
The clinical oxygen dose recorder. So it was made available for a little while, and I don't
Okay.
think it was marketed too much, and it never really caught on. And I'm not sure where it is as far as who owns it, who owns the technology, and what it does. But I have demonstrated it a couple times where, and you don't need to be on oxygen for this. It can do all of the stuff, but it also measures how, if you are on oxygen, it measures how much oxygen your system is delivering, and then you can correlate that to, all right, I was getting enough oxygen in this situation. You might have been sitting watching TV and you were getting enough oxygen. As soon as you got up and went outside to do something, you desatted. The coder would be able to pick up on that and see how much your oxygen system was delivering to you at that time. And if you can see that, hey, it wasn't enough, you know then that you might either need to increase your setting, if you can increase your setting on the device, or maybe that device is not oxygenating you when you need it to.
You make a very good point, and it's something that we talk about in the group a lot, and it's something that I get asked every time I do any type of presentation. People are often given a prescription for oxygen that says 2 liters here for rest, 4 liters for exercise, not taking into account the different, settings that someone might be in. So not all exertion is the same. So if you're, walking on flat surface, you may be fine with 3 liters. But if you start walking up a hill, that 3 liters may plummet you into the 80s. So one thing I try to get people to understand and try to get the education out about is for people to learn how to titrate their system. It's like in the same way when you're driving a car, you can't say, okay, hold the wheel at 15 degrees to the right, because you may start veering towards the right and you need to be able to bring yourself back to center. And that's what, myself, Mark Mangus, Mike Hess, other people are trying to just get people to understand and get the doctors to empower their patients by knowing, use your oximeter and use your instruments as your guide. So with that in mind, can I ask you, can you talk a little bit about the different oximeters available on the market, or the different types of oximeters?
Sure. I mentioned the wrist ox. What we found in our testing is that you get what you pay for when you buy an oximeter. That's not to say that they're all bad or anything like that, but if you're looking at a $20 to $30 oximeter versus a $100 oximeter, what we found is that the $100 oximeter is going to be more accurate, and especially when you actually do start to desat. They all do pretty well when you are in your healthy 90 range for your oxygenation.
Agreed.
But as soon as you start to desat and go down, what happens is they all have different tracking mechanisms. They all track, the timing for that is all different. Their sample rates and all that stuff. So say you go down to 75. You might see one device, it probably takes 5 to 10 seconds to get down to 75. Another one might only go down to 85. Another one might get down, if you stayed at 75 for 2 minutes, it might get there eventually. And what we found is the ones that are more expensive are better at tracking and actually being more accurate as far as what's going on. There is always going to be some sort of delay between what the reading shows and what you're actually going through. So even if you get up and walk around and you look at it and you see that you're at 90, if you're still walking around in a minute, look at it again, because it could be very different. You can't just trust it necessarily at the very second that you're looking at it, because there is going to be a delay. And like I said, what I found is that the more you pay for an oximeter, the better chance it's going to have to more accurately and more quickly track your changes in your oxygenation level.
It's very interesting. I'm really interested to hear you say that, because what I've kind of always believed was that they're all about the same under, if the conditions are correct. When things are not as ideal, if the patient has cold fingers, if it's cold outside, if they're gripping a treadmill, then I think that's where they're really going to show up.
That also impacts their readings. And what we've also found there's a simulator out there called a Fluke simulator that you can do oximeter tests on. It's not the perfect simulator, but it's probably the best that we got. And a lot of our testing has been done on that device, and that's how we've determined that. And you can program in there different kind of finger conditions that somebody
Really?
has: dark skin, cold skin, those type of situations. And again, the finding is that the ones that aren't cheap are better at accurately reporting what's going on. So I don't know if you can see this here. I put on 3 different ones. Are they
Yep,
upside
we can
down?
see it. Yep. It was, yep, better before. Perfect. If you
Okay.
shut the lights and wave your hands back and forth, we could have a mini pulmonary rave.
Sure.
Okay.
After
hours.
I'm fairly healthy. I'm a big dude, but I'm fairly healthy. I'm not sure if you can see, but these are all going to be pretty close.
Okay, those are all.
One of these
Yep.
is a $20 one. One of these is a $50 one. One of these is a $100 one. So I'm just demonstrating here that when I'm sitting, not doing much, that it's going to be okay. If I get up and start walking around, which I can't do, because then we'll be at the rave here. You would start to see some of the differences come out in what they're displaying, and that includes the heart rate and that type of stuff. That's where you start to see some of the delay in the response of the device. So they all have different sensors. Some of the technology is patented and everything, so some can't do what others can do. So it is important to, at least from my perspective, to understand that you get what you pay for when you're buying an oximeter.
It's funny because every once in a while we'll get a patient who says nobody can ever get my oximetry, or they can never get a reading on me, or they'll say they think they're at 94%, and then we get the reading and they're at like 97 or 98%. We use the Massimo, which is a couple of thousand. We don't expect the patient to go out and get that, and they don't need it. But I'm really interested and glad to hear you say that, not because I want people to spend more money, but I kind of had the idea that they were about the same. Now, let me ask you this.
And I don't want to say that makes the $20 to $30 ones bad. Again, they can do what they can do. You just need to understand. Just like oxygen devices, they're all going to be different. And if you try one, it's not going to be quite the same as the other. I just from what we've done with them, I just want to stress that you get the quality is there when you spend a little more.
Interesting.
And I would say the $100 ones. That's what I guess I would personally recommend.
Okay. Now, for the people that maybe can't afford that 100, you're not advising them to throw their $25 one away, right?
Not at all. Not at all. Like I said, especially when you're just not doing a whole lot and you're not desatting a whole lot, you should be able to fairly accurately display what your oxygenation is. But if you are feeling short of breath and you've noticed this trend for quite a while, and your oximetry is showing 93, all the time, even if you're getting up and walking around and doing stuff, that's when you might want to say, maybe my oximeter is not doing what I need it to do. Maybe I should, have it checked out. If you're at a pulmonary rehab, check out one of their oximeters and do a comparison while you're walking around, if that's an option for you.
You mentioned a word that I use all the time in trying to teach people is trends, okay? Because I always say that there's not one number on itself. So somebody will say, my blood pressure was 180 over 110, which sounds terrible, but maybe 5 minutes ago it was 220 over 150. And I think that it's a good thing for people to do, and I recommend all the time that people keep a journal of various parameters, in their day, whether it be heart rate, oxygen, blood pressure, how much exercise did they do, their symptoms. But I think if they track that trend and use the same oximeter all the time, they can at least see a downward spiral or an upward spiral.
Mm-hmm. Yeah, I agree with you. I can't stress enough the importance of keeping a daily log. If you have the time and the patience for it, and probably more so the patience to do something like that, the benefit that gives you to understand what your oxygen needs are during the day and what you're experiencing while you have your certain devices set, whether it's your stationary or portable or whatever, it will help give you a much better understanding of what your true oxygen needs are. You can have your prescription of 2 liters at rest and 4 liters at activity, but your needs are actually going to be fluid, depending on what you are doing during that day.
Absolutely.
So, and if especially if you're on a cylinder with a regulator where, you're most likely going to be concerned about how fast it's going to run out.
Definitely.
If you can exercise and be at 3 as opposed to 4 doing certain exercises, you'll be saving some of that oxygen tank. So you'll be getting more minutes out of that tank. So, and you can only do that if you understand what your needs are in a given situation. And that's where the oximeter is important to help you understand that. And that's why I think it is valuable to have one that is going to be accurate and, not poor quality. Some of them are poor quality. They'll break after not a very long time.
Let's not name them.
Physical with it. Oh, we're not. No.
Ryan, let me ask you one more oximeter question. Because very often you'll see something that'll say plus or minus 3, plus or minus 4. What do you find the average oximeter can be off, like in either direction, either reading more positive or more negative?
Again, that depends on where your actual reading is. If you're in the 90s, plus 3, minus 3, whatever, they're all pretty good. If you get into the 70s, that's where you're going to see, we tested some that never got below 88. And
no matter what you did, you mean they never?
What, it was at 75. The setting was 75 blood oxygen. The reading was no lower than 88, and it stayed there. It dropped over, maybe a 2-3 minute time, and then it stayed there, and it didn't go anywhere else. So that was a poor reading oximeter.
That's terrible.
Yeah. So, the unfortunate thing is there really isn't any way for the user to know that and understand it. And that's where I think it's important to try and get this information out there and show that, you need to be aware of the equipment that you have and understand that, they are going to have some limitations. And it's not surprising that the cheaper ones are going to have more limitations than the ones that are a little more expensive.
That's a beautiful point. I mean, that. If you've learned one thing tonight, that is a really great point. I'll tell you a quick funny story. I was at Marion's house one night, who is the chief of our airway clearance unit, and she has a Mao Zedong thermometer hanging on her wall. And someone brought it to her from China, and I'm looking at it, and I'm noticing that there's not actually any mercury in it. It's actually just a red magic marker drawn to say that it's 85 degrees, and that's kind of what those oximeters sound like. So, they could be a communist oximeter company. All right, let's move on.
You said that, not me.
I did say it. One other thing that I want to say just about the instruments, okay? A lot of times people ask the question, I am short of breath, but my oxygen is 96%. And we talk about the fact that it's airway mechanics, and there are so many different things that go into how well or how poorly we breathe. And it's so important to rely on your instruments as opposed to just how you feel. And it's very similar to like a scuba diver who can't tell their depth, or a pilot who can't tell their altitude without using your instruments. So please try to get instruments that you trust, that are trustworthy, that are valuable, and then use them effectively. So Ryan, let's move on a little bit. If you could just talk about requirements, let's say, between rest, activity, and sleep, and what people should know about that.
Well, I mean, most often your needs at activity are going to be more than at rest and at sleep. Obviously, when your body's not doing much, you're not going to need as much fuel. So if you think of oxygen as fuel, when you're active and up and about, your body needs more fuel to keep that motion going. So
supply and demand.
And the reason you see, we talked about the 2 liter a minute at rest and the 4 liter a minute at activity. The reason they do that is at 2 liters a minute, you're getting 2 liters a minute of oxygen. Your breath rate will actually determine how much of that oxygen you breathe in. So if you're breathing at 15 breaths a minute, I want to say, just based on a calculation of your inspiratory time, you'll get about 44 milliliters per breath every time you take a breath in on 2 liters continuous flow. Of that 2 liters continuous flow per minute, each breath you're getting 44 milliliters at 15 breaths a minute. If you increase your breath rate to 30, which is a typical active breath rate, because your inspiratory time shortens, you get less of that 2 liter per minute oxygen per breath. You actually end up getting the same over the course of that minute, but on a per breath basis, you get about half of what you were getting at 15 breaths a minute. That's why they say your active breath rate should be 4, because that is twice the amount, and that will at least give you the same amount of oxygen you were getting at 2 liters a minute at rest that you now will get at activity with 4 liters per minute. That I understand that, that can be kind of confusing. It can be difficult to discuss this and understand that. So I think we should kind of focus on this part a little bit, because understanding the impact that your active breath rate has on how much oxygen you're getting, I think is a little bit misunderstood. So, and especially when we're talking about portable concentrators, which we can get to a little later.
Sure. So if I'm understanding you correctly, what you're saying is that if, let's say it takes 2 liters to get you to be properly saturated, let's say to 95% at rest, and your respiratory rate doubles, then you're going to need double the oxygen. If your respiratory rate triples, you might need 3 times the setting.
Not quite. Well.
Okay, then it is. It's misunderstood by me too. Then okay.
Yeah. At 2 liters a minute, you're getting 44. Let's just keep it on a per breath basis.
Okay.
At 15 breaths a minute, you're getting 44 mils per breath.
Okay.
If you don't change your setting, when you increase your breath rate to 30 breaths a minute, you're going to get only 22 mils. So
you're going to get half. I got you.
Doubled your breath rate, and now on a per breath basis, you're getting half of what you were getting at rest.
Gotcha.
Does that make sense?
That makes sense,
now,
yes.
So they say go to 4. So that way, at 4, if you were at 4 at rest, you'd get 88. But you're actively breathing now at 4, so you're going to get 44 mils, which is what you were getting at 2 liters a minute at rest. So in order to keep your same oxygen delivery that you were getting at 2 liters a minute at rest, you have to increase your setting to 4 just to keep the same amount of oxygen volume that you were getting. And now that you're active, you might actually need more than what you were getting at rest. So you may even need to set your device even higher than 4 to maintain oxygenation.
Gotcha. Okay. And that also reiterates the case for controlled breathing techniques, okay, for slowing down your breathing rate to try to take that nice deep and slow breath, because when you start to pant, you're getting that much less oxygen per breath.
Correct.
Now, can you talk a little bit about, people say, well, on my concentrator on 2, on my home concentrator on 2, I'm at 93%. On the tank at 2, I'm at 96%. But on the portable concentrator, I'm at 88%. So can you talk a little bit about the difference between the tank and the home concentrator and the portable oxygen concentrator?
Sure. Most likely, if you have compressed gas that isn't filled from one of the home fill concentrator devices, if you have a compressed gas system that's 100%, 99.999 whatever percent oxygen, when that's delivered to you, that is pure oxygen. So if you are at a 2 liter a minute setting on a tank with a continuous flow regulator and you're at 96, that's coming from 100% oxygen. On a concentrator, that oxygen is not going to be 100% pure. It's probably going to be just between somewhere from 90 to 95. I wouldn't expect as sharp a drop off as from 96 to 92 or 93. I don't remember what number you said, but that could be a reason. And if the oxygen concentrator isn't delivering its oxygen within specification, if it's delivering as low as 85 or 80, and it's not alarming, which can happen. You know, it's delivering the same volume to you, but the purity of that oxygen, it's only 80% pure as opposed to 95, which is what it should be. So that possibly could be an explanation of a 3% difference in your sats. And then when you get to the portable concentrator that you are setting at 2, that's delivering in a pulse delivery mode. We just talked about a continuous flow delivery. You get 44 mils per breath at 15. On a portable concentrator at 2, there are very few, if any, devices that actually give you a full 44 mils per breath at a 2 setting on a per breath basis. So at a 2 setting on a portable concentrator, you're getting less than what a continuous flow device would get. And again, there is a little bit of breath dynamics, you know, how long your inspiratory time is and whatever. I'm just
Sure.
trying to keep this simple. So, you know, the biggest difference is on a portable concentrator, especially the pulse-only ones that are set to 2, they can't deliver the equivalent of, we can talk about equivalency. In fact, I would love to. They can't deliver an equivalent to 2 liter a minute oxygen delivery. They don't have the capability to do that. So anybody who says a pulse device, whether that be a portable concentrator or a conserving regulator that is pulse, never say that a 2 continuous flow is equivalent to a 2 pulse flow. That is
never.
Unless you have a very specific breath rate with a very specific tidal volume, with a very specific dose, that is impossible. So it's a fallacy to say that a pulse setting is equivalent to continuous flow. That is my opinion. So let me make that clear.
I agree with you on that for sure.
I'd like to think it's an informed opinion.
I agree with you on that. Now let me ask you this: you mentioned that a home concentrator may not be giving out 99.99% oxygen.
A home concentrator doesn't give out 99. At the most, it's going to give you 95%.
So now, is it important, and is there a way for a patient to check their concentrator, and is it important for them to do so?
If you suspect that your concentrator, they're pretty good at alarming. So let me say that. If they get below specifications, they will alarm.
Okay.
But if they're at 90, if the specification is 90 to 95%, they might not alarm until they get down to 82%. So actually, the specification is probably going to be more like 87 to 95.
Okay.
But they might not actually start to alarm until they get down to 82%. So you could be expecting that your device is delivering you 95% pure oxygen, but it might actually be giving you 87% oxygen. I would say that if you have a very old stationary concentrator, or even a very old portable concentrator, if you have a provider that can test that for you, that's probably the best way for you to do that, is to have a provider do it. Unless you wanted to actually buy, I think Salter puts out a oxygen testing device, purity testing device. And probably that's what your dealer is going to have. Their drivers might go out, or their respiratory therapists might go out and test the equipment. So to answer the question, if you suspect that your device is delivering low purity but not alarming, then yeah, I would say reach out to your provider if you can. If not, maybe go to one of your local providers that you might not use and say, hey, would you be willing to test this for me? And understand there might be a fee associated with that.
Now, just to put that in perspective, so people don't confuse the 82%, that we're talking about with concentration, with saturation. Normal room air has 20, almost 21%. So even if you're getting 82%, I think you're still pretty well covered. Would you agree?
Correct. It doesn't mean that the device isn't operating. It's just not operating within spec. And again, some of them will alarm at 87. We have seen some of them go as low as 82 before they alarm. I think this might actually be a good time to kind of explain how a concentrator works.
Go for it.
Some people, let me grab a device here. For those of you familiar with the Inogen products, they've introduced in the last few years the ability for the users to manually take out what's called the sieve canisters, because those are what separate the oxygen from the air. The sieve canisters. Let me open this here.
Ryan, how often do these need to be serviced?
The stationary concentrators, they're pretty robust. You really, if you've been continually running them, chances are you're not going to need to do anything. Really, the worst thing for a concentrator, whether that be a stationary or a portable, is to not use it. If you let it sit there, if it's just sitting in your corner for a couple of years and you maybe use it every once in a while, what can happen is moisture gets in the sieve and it really degrades their ability to separate out the gases.
Interesting.
So these are designed to be used, and if you don't use them, the chances that you'll need service on them increase.
And we could probably also end that sentence with, if it's in the corner and you use it every couple of years, you don't need oxygen, my friend.
Yeah, well, or you just don't want to use it.
Or you don't want to use it.
Yep. Some of that. So this here is a sieve canister. This is from an Inogen G3. So this is a really small quantity. Your stationary concentrator is probably going to have 4 to 5 times, maybe even more, of what's in here. So what is in here is what is called sieve material. And what that does is when the concentrator takes in the room air, it pushes it through this sieve canister. So it pressurizes this sieve canister. And when that happens, the nitrogen that's in the room air, which is about 78%, I don't remember my science. I want to say it's 78%. It's actually the nitrogen that is getting separated out. And then that is pushed off back into the room air. So when your concentrator is running, every time you hear that sound, and it happens maybe every 5 to 6 seconds or so, you hear the compressor running continuously, but every 5 to 6 seconds you'll hear that. That's actually the nitrogen getting released back into the room air. The oxygen and the trace gases stay in here and then get pushed into kind of a storage area where it's then delivered to you. So when the nitrogen comes out, that leaves mostly, 87 to 95% pure oxygen left, and that is what's delivered to you. So your concentrators are actually removing nitrogen from room air and giving you the rest. So they're delivering you the oxygen, removing the nitrogen, and putting that back into the room air. So a lot of people don't understand that's how a concentrator works. So hopefully that's helpful.
Absolutely.
I will say, the smaller the sieve canister, the more, I don't want to say susceptible, but you have a much smaller amount of material. So if it becomes contaminated, it's going to have a greater effect than it would be if you had the same amount of material contaminated in a larger concentrator. So humidity can damage this, and that's where having them sit around, and especially if you had wildly varying temperatures, if you have it out in your garage and say that, during the winter it could get down to 30 in there, and then in the summer it might be in the 80s or 90s while it's sitting in the garage, you start to get some expansion and contraction going on with some of the connector parts and whatever, that can cause leak into the sieve canister. So that's where the moisture can get in there and cause damage. So.
Gotcha. Now, Ryan, you mentioned something before that I think is a really important point and a very interesting point, because when you were talking about the stationary concentrators in the tanks, you were talking about liters, and then you switched to the portable and you started with settings. So I think
Correct.
That's something that's confusing to people. Can you talk about that a little bit, please?
Right. A pulse device, you can never say, when you set it to 2, you can never say that is 2 liters a minute, because that is not 2 liters a minute. I think one of our favorite phrases is a 2 is not a 2 is not a 2. And that's when you're comparing 3 devices. You have a continuous flow device here, a portable concentrator here, and maybe a conserving regulator here. All are set to 2 only The continuous flow device can actually be considered 2 liters per minute because that is what you are getting. On a pulse device, you are getting a pulse of a much, much, much smaller volume than what, 2 liters a minute is 2,000 milliliters over the course of a minute. On a pulse device, if you're getting 30 and you are 30 milliliters per breath and you're breathing at 30, you're only going to get 900 milliliters per minute of oxygen. So you can't say that 2 liters a minute is the same as a 2 on any of the pulse devices.
So I'm hearing that the difference is between continuous and pulse. When you have a portable concentrator that has a continuous mode, is that still a setting, or is that in liters per minute?
That, if it has continuous flow, and it is like the Sequel Eclipse, that has pulse and continuous. When it is in the continuous mode, then that is continuous flow. And it actually, on their little display, it says LPM. When you set it to the pulse setting, it actually says on the display, if you set it to 2, it's 32 mils per breath. So it tells you how much it's delivering to you per breath. When it's continuous, it actually says 2 liters per minute.
Gotcha. Ryan, can you talk a little bit about the different sort of the devices that actually go onto your face or into your nose? So like the differences between, let's say, using a nasal cannula versus a mask versus the different types of masks, and then also the conserving devices. Why don't we start with just a basic nasal cannula?
Sure. And like you said, the basic cannula, that's the most direct form. You got the prong sitting in your nose, the oxygen is going directly in. So every time you breathe in, or even if it's just continuous, it's continuously running. It is close to your nose, so you're breathing it in. On a mask, it might be coming in at a port at the front here, so that way you can breathe it in through your nose and your mouth. But there may be some dilution with the room air, so it might not be as high a percent as oxygen as you would be getting here, depending on what again, there's some other factors like tidal volume and that type of stuff that can impact that. What else?
Let me ask you this: with the cannulas, is there a limit that you would suggest to how much oxygen is effective before going to a mask?
Actually, I had the oxygen user just call me yesterday asking about, they're a higher flow user, so they use their oxygen between 10 and 15 liters a minute when they're active. They like to go swimming, and they had been using a standard 7-foot cannula. And really, you shouldn't be using a standard 7-foot cannula that isn't indicated for high flow. The highest you probably want to go on a standard non-high flow cannula is probably 7 or 8 at the most. And even then, I would probably say you might be better off getting a high flow cannula from 5 liters a minute and up.
Agreed.
And the cannulas, they will say what type they are. If it's a high flow cannula, it's going to have an indicator like HF or say high flow or something like that. I believe the Salters, you have the Salter 1600, that's a fairly standard cannula. The high flow version of that is the 1600 HF. So there will be some sort of indicator on there to say it's high flow. And typically what they are is they have less restrictive tubing. I haven't actually measured it, but they might be a little wider, and especially the part that comes around your face and into your nose. Typically, those are the part that goes around your face and comes to the T, wherever you might put that. That's typically the most restrictive part of the cannula. So when you have a device that's trying to push 10 to 15 liters a minute through there, the back pressure is going to be pretty high. So your device might be saying 10 to 15 liters a minute at the outlet, but by the time it gets to your nose, it could be significantly reduced from there. So if you are a higher flow user, you probably should be using high flow cannulas. If you're using and I'm not talking about the high flow humidified oxygen cannulas. Let's make that clear. I'm talking about your standard 4 or 7 foot oxygen tubing cannulas, and they will say high flow.
We'll generally let people go to 6 liters per minute maximum with those. Because I feel like after that, you're just wasting oxygen. You're drying out the airways in a way that, is going to be very uncomfortable for the patient. And if it doesn't keep them saturated at 6, Like if you really have to go to 15 on a cannula to get someone saturated, they're going to benefit from a mask anyway.
Sure, sure. For some people, that might not be feasible. We have seen some users. Liquid is nice because you talked about drying out. If you most high flow users really could benefit from liquid. We can talk about that in a bit too. Liquid oxygen, it's going to have some humidification in it that dry gas is not going to have. So if you have a liquid portable that does 10 to 15, which there are several out there, that I think that's less of an issue. But that, I'm not the one breathing on it, so that probably depends on the person too.
And just to clarify, you said dry gas, right?
Yes.
For a second there, I thought you were cursing on my show, Ryan. All right. So that's the after-hour show. Now, while we're on the topic of humidification, a lot of people ask about those bottles that go on their concentrator or on their tank. How effective are those? Because they seem like, I don't know, it's hard to say, but if you're really having a problem with dry nose and things like that, do they help much?
They help. Whether it helps much or not is probably a factor of your environment. If you're in a more humidified area, that's going to be helpful. The issue is it comes in and your level, there isn't much surface area in that bottle, and that's a big part of what helps create humidity basically. So the flow comes into the tank, you get the bubble stuff, and you got to make sure that that's sealed tight. We've seen some where the bottles aren't sealed tight, so you might get some leakage out of there. There might not be enough pressure there, but you do got to be careful with your connectors and how well your bottle is screwed on to your concentrator there. That probably is your mileage may vary type scenario.
Gotcha.
It's not going to work for some people. If you're up in Denver or something like that, where the air is going to be drier, it might not be as effective as it would be for somebody who's living in Florida.
Can you talk now? I think are we ready to go on to liquid oxygen?
Oh yeah, we certainly can.
So let's talk liquid a little. I think it's something. I mean, I would say if I see one patient a year with liquid oxygen, it's a lot. But a lot of people are, have a hard time getting it. So can you talk a little bit about the advantages and why people might want that if they can get it?
Yes. At its most basic, liquid oxygen is the most efficient form of oxygen storage. Let's say, I have a pop bottle here or a water bottle. Let's pretend this is a 2-liter bottle, just for the sake of argument. If this was a 2-liter bottle of just pure gas, you would have 2 liters of gas in here, and you would breathe that in a minute. So this would only last you a minute if it was 2 liters of pure gas. If this is 2 liters of compressed gas, which is what comes in your cylinders, that'll probably last you about 3 times as much. So you'll probably get roughly 3 minutes or 6 liters of gas out of this 2-liter bottle of compressed gas contents. On a liquid device, I don't remember exactly what the conversion factor, I want to say like 760 or 780. For every liter of liquid oxygen, you get 760 or 780 liters. So a 2-liter bottle of gas, liquid oxygen, is going to give you roughly 1,500 liters of oxygen, which can last you a really, really long time.
Incredible.
So that is why liquid oxygen really should be what most oxygen, especially the high flow users, because a lot of the concentrators and the portable devices just can't deliver enough to meet their needs. You have the liquid portables that are capable of delivering 10, 12, 15 liters a minute, and they can last you for quite a while because of the expansion factor that goes with liquid oxygen. So you have, you see people that do have liquid, they have their Helioses and that type of stuff. Those are really efficient devices. And even the continuous flow ones, if you have a continuous flow cylinder set to 12 liters a minute, even the larger tanks, you're going to burn through that pretty quickly.
Yeah.
At least with a liquid device, you're going to get a few hours out of that.
Why do people have such a hard time getting it?
Cost.
Very expensive.
The cost of producing it, the cost of delivering it, the cost of maintenance of the equipment. That is absolutely the biggest factor. So over the last 10 years, as we've seen the Medicare cuts, they've cut things everywhere, but especially for oxygen services, liquid was pretty much the first thing to go because that was the most costly thing to the providers. So not only do you have to have somebody deliver it, you have to do it on a scheduled basis. You have some of this equipment that can be at times difficult to maintain. There were plenty of issues there that were reasons why liquid was the first to go, and that is a travesty. If I'm being straight up here, it is what it is. We're in the environment that we're in, but if I had my way, every oxygen user would have some form of liquid oxygen,
Interesting.
if at all possible. It's the lightest. It lasts the longest. If people want the lightest, longest lasting oxygen concentrator, give them the lightest lasting, longest liquid oxygen portable. They'd be happy.
Interesting. For that reason, I mean, even patients who want to pay for it are having a hard time getting it.
Yep. Yeah. Some providers are just like, we don't do it at all. It is not part of our service plan whatsoever.
If we want to, on a side note, if we want to take your let's imagine that this is a 2-liter bottle, we can also suppose that you're a giant holding that 2-liter bottle as well.
Yes,
So
yes,
if you
let's
want to
do
go
that.
sci-fi with that, that could add to the interest of the.
I'm 8 foot tall, 450 pounds.
There you go. And I saw you in Lord of the Rings, but that could really add to the viewing experience for our viewers. Can you talk just a little bit about the different conserving devices that a lot of people don't know about and for some reason are never recommended?
Sure. A conserving device, that actually encompasses quite a few things. Basically, a conserving device is a pulse device. Any device that is delivering oxygen continuously, there's a lot of that is wasted. Any oxygen that's delivered continuously, when you exhale, you're not breathing any of that in or whatever. So that's where the idea of conserving devices came from. They would only deliver oxygen when you're breathing in, or at least from the start of your breath until the end of your breath. Some of them, they actually deliver within a specific time frame, so they may not even deliver to the end of the breath. But the idea is that they're not running continuously, so they are conserving oxygen. So portable concentrators in pulse mode could actually be considered conserving devices.
Gotcha.
Because they are conserving their oxygen. But typically, conserving devices now might mean something on one of your cylinders here. So this is actually a continuous flow regulator on here. Here's a fairly common conserving device, which is the Easy Pulse 5. So this has 5 pulse settings. Let's make that clear. 5 pulse settings and 1 continuous flow setting at 2 liters a minute. Your standard regulator, continuous flow regulator, it could have anywhere from 4 to up to 8 or 12 settings. But a conserving device is going to be one that does not deliver oxygen to you continuously. So that's where the idea of that came from. And when you mentioned when you were introducing me our conserving device guide, that was shortly after portable oxygen concentrators started coming onto the market. So they were just starting to become an option for people. At that time, most of what people might get are something like this, a conserving regulator. You didn't want to go through your tank very quickly, so you would get a pulse device. And much like portable oxygen concentrators today, there is a wide variety of conserving devices that were out there. So, and they all did very different things. They all pulsed very, very differently. They all had very different sensitivity values. So that's important. When you breathe in, the device needs to be able to sense your breath. So if it's not as sensitive, it might get delivered later in your breath. So you might not be getting all of that oxygen that it is delivering. So really, you could say conserving devices really increase the amount of variables that are present in oxygen delivery. Continuous flow is known as the gold standard. It's been around forever, but it's also fairly simple to understand. Once you start introducing things like sensitivity,
Right.
Pulse volumes, peak flow, all that stuff, you're suddenly adding a whole bunch of different factors that can impact the oxygenation that you get from the pulse flow delivery. So
Now, let me just ask a question about that. So, if I'm hearing you correctly, I think it's important that you stick with the cannula or the type of cannula recommended. So that's not going to be effective if you have a 25-foot hose, correct?
Yeah, if you have a conserving device and you're using a cannula, the length of the cannula will impact the sensitivity and it will impact the delivery. So let's say uh, let's say this delivers at a peak flow of 10 liters a minute for a very short time, say 200 milliseconds or so. So that's the pulse that you're getting from this when it's on a 7-foot cannula. And this is just hypothetical. I'm just using this as an example to try and explain. Once you add a 25-foot extension tube to a pulse device along with your cannula, so now you have 32 feet of tubing. What happens is your peak flow is going to go down. So it might go down from 10 to say 8, and your delivery time is going to get longer. It might go from 200 to 400 milliseconds. Basically, you're adding a whole bunch of restriction. Plus, your device is probably going to be a little less sensitive. It's going to take longer for that system to pick up. Even the portable concentrators, most of them say don't go over 25 feet. So if you have a portable concentrator and you are using anything longer than 25 feet, you might want to check the specifications and make sure that they approve that. But understand it may be impacting your flow delivery too.
Gotcha. One other point I want to make along those same lines is that a lot of people make the mistake of thinking that the goal is to trigger the device. And therefore, they hear that sort of like a whoosh, and they think, okay, I'm getting the oxygen. And, it's really important to understand, as we talk about in many of the other webinars, but we really need to get that oxygen into your lungs in the same way that we need to get those inhaled medications into your lung. So it's really important that you learn how to use your device to maximum advantage, meaning that when, the idea is not just to trigger the device, but it's to trigger the device at the same time that you're really taking a good deep breath into your lungs and then blowing out through pursed lips and getting yourself into a habit of maximizing every breath and every time that machine discharges. Because otherwise, in addition to not getting all of the oxygen that you want into your respiratory system, you're going to burn through that tank a lot faster. And it works very much the same as a scuba tank, which is that when somebody's nervous and they're underwater and they're breathing very fast, they could blow through that tank in minutes. And it's the same thing with these oxygen devices. So in the same way that we ask you to practice the controlled breathing techniques with exercise and during walking, practice them in the context of using your device most effectively. Now, I may...
That actually brings up a good point
Sure.
I'd like to talk about. There are different triggering sensitivities for these devices. So when you're breathing, when you do breathe, kind of
Right.
quick, the chances the device are going to pick up on that are greater. But when you're at rest and say sleeping on a pulsing device, that's where the concern comes in, because your breath pattern is a lot more shallow. So its ability to pick up the signal early is going to be diminished because your pattern is much more shallow as opposed to much greater slope to it. So if you're sleeping on a pulse device, especially ones that aren't as sensitive as some others, that it may not trigger, for one thing, and if it does, it could be late enough, towards the peak of your inspiratory, and then you're going to have, it picks up the signal, then there's going to be maybe 100, 200 millisecond delay of the picking up the signal and the oxygen getting to you. So all of a sudden, that oxygen is being delivered to you at a time in your inspiratory cycle that isn't really beneficial. Most of it might stay in your trachea. So that isn't even going to get into your lungs. So that's the concern with sleeping on a pulse device, is that unless you are tested for it to make sure that you're maintaining your oxygen for the night, I can't with a good conscience say, yes, you should sleep on a pulsing device. If you have a continuous flow device, especially a stationary concentrator, that is your best option for sleeping at night. If you need to use a pulse device, lots of people travel and drive around in their cars or whatever. That's okay, but you might want to kind of say, all right, let me maybe see if I can keep track of this. If you wake up and check your oxygenation or something like that. I don't want to say completely don't sleep on a pulse device, but I can't recommend it.
I feel the same way.
Unless you are tested for that.
I feel the same way. And people ask that question all the time. And then, I know people point to research and say that it's just as effective. For me, it worries me. It really does worry me. It's one of those things. It's like there's a segment of Bill Maher where he's like, I don't have any proof, but I know it's true.
Sure.
And it's like, in fact, the proof probably says that they're okay to sleep on a pulse device. But for me, I wouldn't want to do it personally.
Yeah, I wouldn't. And, I'm not going to say to somebody, if you're going to do it, at least get a test. Get one of those wrist ox. Ask for a wrist ox and have them evaluate you when you go home and sleep on your device, or if you're traveling somewhere, sleeping on that, just to make sure that you're maintaining your oxygen or oxygenation during your sleep time.
Sure. Now I believe I must have misspoken, and when I said conserving devices, I may not know the formal name of this, but what I was thinking in my mind was the oximizer. So
sure. I actually have one of those here. So what the oximizer is, it's a little fancy cannula.
See how he did that? Ryan, What I was talking about was a white rabbit. Do you have one?
White rabbit?
Do you have one of those there? No.
So I don't. Sorry. The oximizer, it is considered a conserving device in the sense that, in addition to the oxygen that is being delivered to you continuously, and again, you can only use this with continuous flow oxygen, because if you put this on a device that is a pulse flow device, this part and the tubing, it might not, the sensitivity might not be enough to have the oxygen delivered in time. So this is only recommended and specified for use with continuous flow. So what happens is your flow is running through here, and during your exhalation, when you're not actually breathing in any of the continuous flow oxygen, there is a volume of oxygen that is stored in here. I don't remember exactly what the amount is, but it's enough that when you breathe in, you get your continuous flow oxygen plus the volume that's in here. So it's actually increasing the volume of oxygen that you breathe in. And really, the important thing to remember with these is that these are going to be much more effective at lower flow settings than they are at higher flow settings. Anything above 5, these probably aren't going to be that effective for you. And especially, once you get if you're trying these at 8 liters a minute, these aren't really going to have much of an impact, just because the volume that's stored in here compared to the volume that you actually inhale at 8 liters a minute, this is a much smaller fraction of that volume than it is when you're breathing at 2 liters a minute. So some people have said that they, without this, they need 4 liters a minute. If they have this on, they can reduce their flow setting to 2 or 2.5 or so. So it is beneficial mostly for people that use continuous flow, at the lower continuous flow settings. And that can be important when you have if you're out with a cylinder or any sort of, continuous flow device.
Sure.
That, like a liquid device even, that is delivering continuously, that will help you prolong the life of that tank, just because you are able to get a similar amount of oxygen at a lower flow setting.
Well, I think it also increases concentration as well, doesn't it? By having the reservoir?
This has nothing to do with concentration.
Really?
So regardless, if you're on a stationary concentrator, the percentage of oxygen in the gas is going to be 95%, no matter what's in here or what's not in here. This does not affect the concentration that you're breathing in.
Interesting.
Yeah.
And is that the same for a non-rebreather then as well?
I can't say I'm too familiar with non-rebreathing masks. I haven't really tested those here, so.
Okay. So now here's another question. What's better then? Would it be better to be on 4 liters of, and I'm just using this as an example, is it better to be on 4 liters of pulse or 2 liters of continuous? How do we know what's going to be the better setting for
I
it?
just turned the volume down on this. Hold on a second. I can't hear you. Are you there?
Yep. Can you hear me?
Okay. I can hear you. Sorry about that. There's
Okay.
a button on here.
So my question is, so is it better for the patient to be using 4 liters on a conserving device, or is it better for them to use 2 liters continuous? And how do we know who's good for what?
You're not using 4 liters on a conserving device. Let me make that clear again. A conserving device is going to be a pulsing device, or I guess, something like this. Again, this isn't, when I say conserving device, I'm not talking about this. They advertise it as a conserving device, and in a sense it is, because it does allow you to reduce your continuous flow settings. So this, if you're referring to this, I would say it is advantageous to use this at a 2 setting. You would need to check your oxygenation to make sure, but there are plenty of people out there who have said, I was using 4 without this. I can oxygenate at 2 with this, and now my tank lasts longer. So
Gotcha.
like, if you figure 2 liters versus 4 liters, with this, that your tank is going to last you twice as long.
Okay, can you talk a little bit about the OxyView glasses? I know a lot of people like.
Yeah, we got those here too. So I don't know how well you can see this here, but here's the cannula for the OxyView, and it comes in the side of the frames here on both sides. So just like a normal cannula, and it comes through the glasses frame here and up over, and then there's little tubes here that go into the nose. So for people who have issues with the tubing that's coming through here, or just don't like the look of it, these are an option. The issue is that these are pretty restrictive tubes as well as up here. They're not very wide. So you need to be careful to understand whether or not your flow rate is being impacted by the restriction through here. But there are plenty of people out there who like and use these and get by with them fine. So if this is, I know that these aren't necessarily too well known. So if there's any people watching this that find these to be pretty fascinating, definitely look them up because they're pretty slick.
Can you choose your own frames?
I believe so, yes. I don't know. It's been a while since I looked. I think they had a select amount. But yeah, it's not like there's one. I don't think there's one standard type of frame, unless that's changed. I guess I'm not too up to date on what's available with these as far as
I believe
styles.
their website is oxyview.com, but I'll put a link to that up there as well for people. Couple of more questions, and then I want to talk about the portable oxygen concentrator guide. But can you talk for a minute? Really, there's 2 more things I'd like to touch on, which are, 1, transtracheal oxygen.
Sure. So what happens there is you basically get a hole put in your neck. It ends up bypassing your total upper airway. So that could also be looked at as a way of conserving some of your oxygen, because this is all considered dead space. So you're suddenly delivering all your oxygen into here. It has far less space to travel to get into your lungs. So we had one of our good friends here, Jerry. She had a trach put in, and she was using a Sequel Eclipse at 3 liters a minute, which is its maximum continuous flow setting. She was basically using it at its maximum capability. When she got the trach put in, she was able to use it at a 1.5 and a 2. So that's important, because that improves the battery life. At 3 versus a lower setting, the 3 is going to go through that battery a lot quicker. So that gave her a lot more opportunity to be away from a power source just by having that in. I mean, this, it's a surgical procedure, so it's a little more invasive than some of your other things. But as far as I know, the people that have had it done have spoken positively of it. So.
I agree. I mean, it sounds dramatic. It sounds very dramatic.
It does.
But
and there are things, you need to clean it and all that stuff. It is important to maintain. But for those that are, especially we're getting to the point where the higher flow users, their options are very limited.
Mm-hmm.
That might be something that they want to look into to at least mitigate some of that difference between the currently available oxygen devices and what would actually be available to them. A trach may help them kind of let them enter back into the market of optional or the best options for them with lower producing devices.
Gotcha. Now, the last thing I want to talk about before we go to the guide, unless there's anything else that you want to talk about, is I would love your take on the new NIOV system. We're going to be getting one in our clinic next week, and we can't wait to really use it on a lot of our patients. What's your experience with the NIOVs?
I would say it's pretty slick. It's probably engineered more than it needs to be, which is not a bad thing, but it's a pound, and it can roughly sit on somebody's waist. In addition to delivering oxygen, it uses a Venturi cannula, and I think I have one of those here as well. I was hoping we had one of the NIOV devices here, but we don't. But I do have the cannula. So I think some of the patients or oxygen users' biggest qualm is the size of the cannula. It's certainly bigger than what they're used to. It looks more like a nasal CPAP pillows. But you can, hey, there you go.
This is popular with the hipster crowd in Williamsburg, who are into mustaches.
Sorry about that.
Ryan, while you had your headset off, I had a magnificent joke, which is that this is popular with the hipster crowd in Brooklyn.
Oh, totally. So what this does is, in addition to the oxygen that is coming through the device, there's a Venturi port here that it's delivering at a relatively high flow rate. So it pulls in some room air, and that gives you a larger volume, and that creates some pressure in your lungs. So that opens up some of the airways to allow the oxygen to get in there a lot better than without any pressure. So it kind of operates like a bilevel, and your lung conditions will impact the efficacy of this, in the sense that if you have more restrictive conditions, the pressure that this can generate will be higher. If you tend to be a healthy person, you're not going to get much pressure from this when you breathe in. But if your lung conditions are more restrictive, you can get quite a bit of pressure depending on what you have the setting to. So it's basically a combination oxygen device and kind of a portable bilevel ventilator type device, and they are pretty slick. And I don't know if we have it on our website anymore, but we did have a user here who, the very first time I saw him, he could barely move. He wanted to be active again. He was on oxygen. It was tough for him to do much of anything, and this isn't going to be the case for anyone by any means, but his life was literally altered by this device. I saw him maybe 6 to 8 months ago. He walked in here without oxygen.
Wow.
And he was fine. So the therapy that this device gave him allowed him to become more active, get more conditioned, become more healthy. So this was a game changer for him. And I'm not sure, where this is being distributed now. I'm glad to hear that you're getting one. They're good. I think it depends on the user and that type of thing. It's not going to be for everyone, of course.
Sure.
I have a very clear picture of somebody that this greatly helped. So.
I'm glad you brought up the point about him, being able to increase his activity so much that he improved. Because I think a lot of times people get the idea that this inhaler or this NIOV or this device or that device are going to be the therapy that, is an indefinite therapy to change their life. Whereas I think the key is that this is like the grease that allows them to do much more work, and it's those big workouts that change people's lives.
Yeah, there is the Bob talks about the knot study all the time, which demonstrated, especially in the first year or so, how important activity was to improving longevity of life. So oxygen was important, but also activity was very important. And that's why it's kind of frustrating with a lot of these devices that are not delivering enough oxygen to the users for them to be able to be oxygenated for a longer period of time.
Sure.
The importance of exercise is just great. You have to be able to exercise, and if you don't have a device that allows you to do that, then it's not necessarily helping you that much. It might keep you oxygenated, but if you're walking around the mall and you need to sit down at a bench, every 100 yards or so to catch your breath, then you're not really conditioning yourself very well. The device isn't giving you enough oxygen to keep going. You want to be able to keep going, and it is possible. I think some people might get frustrated and say, I can't do it, and that's certainly understandable. But if you have the proper equipment
Sure.
to do it, then it is possible. And I understand, with the way things are right now, it's very difficult to get the equipment that you want and that might actually benefit you. So
Sure.
we're in a very bad place right now when it comes to effective oxygen therapy, and especially on the home side. I feel for all of the oxygen users out there, because at the end of the day, they're the ones getting screwed.
Sure. Sure. One thing that is one of my kind of pet peeves when it comes to oxygen use is I hear very often about people who are taught to exercise or who go to rehab and exercise, and the workload is kept low in order to keep their saturation high. And
Right.
I think we use
That's
probably
counterintuitive.
exactly right. And I think we probably use more oxygen than anybody else. But what I try to get people to understand is that even if we have to give you 100% O2 at 15 liters, if we can get you up to a workload that is high enough, that's where the change comes in. And
Yep.
what people don't realize, and it's funny because it's not funny. I take it back. It's sad, but it's not just patience. But what I try to get people to understand is, if you get short of breath walking upstairs, if you get short of breath walking uphill or running for the bus, then at that workload, I can exercise you low intensity and long duration till the cows come home, but that's not going to make you better at those high workload activities. And if you want to change your life, you have to change your life, meaning that if your life requires this, we will exercise you up here, and we have to do whatever we need to by hook or crook to get you up to those higher workloads, because that's really where the change comes in.
Exactly. I could not stress the importance of exercise and trying to push yourself. And if your oxygen equipment, especially, isn't giving you the ability to do that, you need to look at some different oxygen equipment.
All right, Ryan, I want to do one more thing, and then we'll go to questions. So, people, let me plug a couple of things here. So first of all, I want to talk about the pulmonary paper, which, in addition to really having some great cover photos, okay, every year
they have awesome photos.
They really do, and I'm a photographer, and our place is circus like also, and I love people with a sense of humor, and I love their photos, and I love how happy everybody looks. This is a great paper, okay? This is the pulmonary paper, and its contributors include a lot of people, that I respect highly. I know that you're a contributor. Mark's a contributor. Dr. Bauer is
John Goodman.
John Goodman, yeah. I mean, these are the top guns. These are the people. These are like the I don't want to say old timers, because that sounds like I'm making an ageist statement. But these are the guys who were doing a lot of kind of the most basic and the earliest research on a lot of these things. So, Ryan, every year you do this, this sort of oxygen review, and you talk about the different devices as they currently are. And so I want to just, number one, I'll provide the link for people to get to this review online. But I would also recommend subscribing to the paper. It is a great paper. And I'm not getting paid by the paper, obviously, to say. I just think it's a good product. But maybe you can kind of walk us through a little bit of what some of these things mean. And then, maybe if you have a couple of sort of go-to devices. So I'll just go through the chart, quickly, and if you could sort of just, tell us what we should know about this. So you
Sure.
talk about first the maximum oxygen production in milliliters per minute.
Correct. So we kind of were talking about, the continuous flow capability. At a 2 liter a minute, you're getting 2,000 milliliters per minute of oxygen. So we're looking at these portable oxygen concentrators kind of through that lens. How much oxygen can they produce per minute? So at the low end, you have one device that can produce 333 milliliters per minute. It only has one setting. So that
On and off.
obviously is not a very, very good amount, or not a lot amount of oxygen. If you have very low needs, that device may work for you. And if it works for you, then it's a great device. If it doesn't work for you, then you need to look at something else. That doesn't make it a bad device. It just means that it's not a device that should be an option for you. So, and then you go to the high end, which are your continuous flow capable portable concentrators like the Sequel, the OxLife, I think Invacare has one. Respironics has a SimplyGo, which goes up to 2 liters per minute.
2,000, yep.
So those produce 2,000 for the SimplyGo and 3,000 for those other ones. So you have a wide range of capability, and I don't remember how many devices are actually in there, but I think we're at around 15. So you have 15 devices that range in production capacity from a third a liter per minute, 333 milliliters per minute, up to 3,000 milliliters per minute. And just for comparison, your stationary concentrator at home, most likely its production is going to be 5,000 milliliters per minute. So they can produce more than any of these portable concentrators can. So you look at most of these now are pulse devices that fall within about the 750 to 1,250 milliliters per minute range. So figure an average of around 1 liter a minute of oxygen that they are capable of producing and delivering to you. So that is their maximum production capacity.
So now, what does that mean for the person who needs 3 liters per minute on a tank? Does that mean it's not going to do the trick at all?
It doesn't necessarily mean that, no, because what the devices do is they divide up that oxygen on a per pulse basis. So they're not delivering it to you continuously. It's on a per pulse per basis. So that gives them some leeway to give you more oxygen. And all of the small ones that cannot do continuous flow delivery, so all the ones that are pulse only POCs, they have what's called a minute volume delivery. So they can only produce so much oxygen per setting. So if you're at the maximum of a 5 on an Inogen, which is around 1,000 milliliters per minute, when you're breathing at 15 breaths a minute, it's able to give you more per pulse than it does at an active rate. So it gives you the same amount over that 1 minute period, but on a per breath basis, it's actually giving you less when you need more. So if you're at a 5 and you can oxygenate at a rest, and this includes the other devices that are similar to it, that also have 5 or 6 settings and produce around 1,000. If you're already at those settings and they can oxygenate you at rest, but they can't oxygenate you when you are active because you actually need more than what it can give you because you are active and need more oxygen, then that device, you might need to look at something else so that, and it being one of the continuous flow devices that can produce more. So it can give you more oxygen than the pulse devices can.
Gotcha. And I guess the other benefit is that you're not, you're not getting the oxygen streaming out when you're exhaling and wasting it, or
right.
Like
There's no wasteful oxygen on a pulse device. So because they are pulse devices, again, they are able to divvy up that volume that they have depending on what your breath rate is. So that's the important thing to remember, is your breath rate does impact how much oxygen you're getting per breath on a pulse device.
Okay, and then you go on to talk about the available settings. And in the settings, you talk about, and again, I can't stress enough that these are settings, not liters per minute. And you talk about
you will see in there that where it says settings for the pulse device, it just says 1, 2, 3, 4. When you look at the continuous flow portable concentrators there, you'll see that they have the settings of 1, 2, 3, 4, 5, 6, and then they also have 1 liter, 2 liter, 3 liter per minute flow settings.
Gotcha.
So you have your pulse settings, which are just numerical. Bob likes to use the example that you could, if you had a device that has 3 settings, instead of naming it 1, 2, and 3, you could have it be a star, a dolphin, and a flag or something. There is no intrinsic value to that labeling system.
Exactly.
It just means 1 is the lowest, and if it's one that goes up to 3, 3 is the highest. It doesn't necessarily associate with any sort of volume or promised delivery, especially on a minute volume, the portable devices that are pulse only. The continuous flow ones, some of those have fixed pulses where they don't change based on your breath rate. It delivers the same, but they can produce more, so they have the ability to do that. Whereas the smaller devices, in order to not exceed their production rate, which if that happened, what happens is the purity of oxygen goes down. So that's kind of a fail-safe. So to make sure that you aren't overstressing the device. Does that make sense?
Yeah, absolutely. My final question before we go to audience questions or Facebook group questions is, when we talk about doing, let's say, a contracting job, okay, they say that people want 3 things. They want the job done well, they want the job done fast, and they want the job done inexpensively, okay? And there's a saying in the business that says you can have any 2 of the 3. And when it comes to oxygen concentrators, I would say that people want something that's going to be light, it's going to give them a lot of oxygen flow, and it's going to last for a long time. So again, I think it's kind of similar in the sense that you could have any 2 of the 3. You could have something that gives a lot of oxygen and lasts a long time, but that is not going to be light. And, work out the math. But so with that in mind, are there a couple of units, and if you're not comfortable saying it, by all means, we'll just direct them to the thing, but are a few units that you like more than others, or that you think?
On the pulse-only side, the Inogen device has been around a long time, and I think that says a lot about the quality of their devices and their products. They've responded to consumer feedback and whatever. The important thing is that it will be good for you if it oxygenates you. If it doesn't, then you need to look at something else, and that doesn't make the device bad. It just means it's not applicable to you. So in that sense, Inogen, and they can, they don't need to, they distribute directly. So you don't need to go through a provider to get their equipment. And they have, I showed you earlier, the sieve canisters. Typically on oxygen concentrators, whether that's a stationary or a portable device, it is the sieve that needs to be replaced or that has the issues most often. So they've actually been able to engineer their device so that whether they have a new stationary concentrator too that also have those removable sieve beds, they're the only product line that has that capability. So if and when they go bad, the user can just take them out and send them to Inogen, and then you get the new set back that you put in there. If you have any other device, you need to bring that into a service center, and that that could be $800 to $1,000 in some cases. So in the sense of the pulse only devices, I would say I could recommend Inogen. I could recommend any of them, provided they give you what you need. But if you are just going to take a list of a couple of the pulse devices, the Inogen, the Simply Go Mini. What else is on that
Do
list?
people ever have an opportunity? Do people ever have an I'm sorry. Do people have an opportunity to test these out at all? Because it seems like that would be a great service.
that is a thing. Like it's not necessarily convenient. You can't just walk into a provider and say, hey, some of them do rent them, but they might not have a wide variety of products. There are a couple online places that you can rent from, and I would suggest if you are interested in a portable concentrator that you do rent it first. You rent it for a week and try and use it as much as you possibly can to see if it is oxygenating you during your daily activities.
And use it
If you
with your
can't,
pulse oximeter.
yes, yes. And if you can't, definitely do your research. And you showed the comparison chart. That's a good start. Talk to people that have, if you're in a pulmonary rehab, talk to the people that do use them and get their feedback, and see how they feel about those devices. There are ways, but I do recognize that it's not always easy to just say, hey, I want to rent a device and see what it does for me. So I just say, if you possibly can find any way to do that. I do, some people go onto like Craigslist and online, and I'm kind of skeptical of that. I know some people are able to find good deals. Somebody passed away and they're just trying to unload stuff, and it's not been used, but you don't know what that equipment has been through. So I would say I am leery of going the used route, unless you know the device very well.
You don't know what the home environment was like, if there was mold, if there were 18 cats.
Exactly. And if it was sitting in a corner for 3 years.
No disrespect to cats, by the way. I love cats. All right. So, Ryan, if I'm not missing anything or there's nothing else that you would like to add, if there is, by all means, you have the table. If not, we could go to questions.
We can move on.
Awesome. Okay. So, first question from Barbara. My saturation actually worsens when I use the oxy mask rather than the high flow cannula. Could this be because it's too big, or more likely because I'm mouth breathing? At least with the high flow cannula and mouth breathing, the oxygen is being pushed down my nasal passage.
I can't say I'm too familiar with the oxy mask. Do you know what it is?
I looked it up. I'm not sure if it's a specific mask, but if I could make a comment about masks in general, I mean, there's a number of different reasons why I think this could be. I think maybe you're making more of an effort to use it when you have the cannula. I think sometimes it could be escaping, and the key to any mask is that it's a good fit and that it's tight enough. So if it's the right size and it's tight enough, we do have a lot of patients, not a lot of patients, but we do have some patients who, if they are smaller, if they do have, a little bit more of a smaller face, then we use a pediatric mask with them, and that sometimes works. That may be something that you can try. I don't have direct experience with the oxy mask, if that is a specific brand name.
Yeah, me either. So, you touched on the seal and stuff. So if there's leakage, you might be diluting some of what's getting in there. I guess I can't say I understand if she's saying high flow cannula, if that's, a high flow humidified oxygen cannula, or if that is your standard high flow cannula. So
Gotcha.
I guess not understanding her situation, I'm not sure.
Gotcha. And Barbara, by all means, I mean, we can discuss that further in the group if you want to, sort of clarify that. But I think, one thing I would say right off the bat is maybe trying a pediatric mask, or trying, we sometimes get masks and sometimes they substitute what we want with a different mask. And believe it or not, there is a lot of variability from company to company and mask to mask. So I would suggest ordering a few of them. They're luckily not that expensive, and seeing which one you get the best results with. Next question. Even when I walk with my oxygen tank, my SAT levels drop to 83 to 85. Could this be anxiety? I'm actually scared to walk very far. Even on 5 liters, the same thing happens.
So in that situation, I'm wondering what she's comparing it to. Is she on a stationary concentrator at home that's set to 5 liters? And is she out? If she goes out, is she still on a continuous flow device? Is she using a pulse regulator that could be giving her a different amount of oxygen? Plus, she's active, whereas if she's at home on 5, she might not be needing as much. I guess I'm not understanding that situation either.
Okay, so this is Mike. I would say, Mike, could it be anxiety?
Oh, Mike. Sorry.
It could be. It could be that you're breathing faster and shallower, and maybe the oxygen's not reaching in, going down into your lungs. But again, I think if you're up at 5 and it's not doing the trick for you, I would think about using a mask. Where we're going to get a lot better concentration on a lower, you're going to get a lot more bang for your buck. But also being aware of your breathing pattern and really trying to slow it down and make sure you're taking those deep breaths in through your nose and out through your mouth. Or I know there's going to be people say, I can equally breathe in through my mouth. And you can, okay, but just making sure that they're slow and deep enough to get into the lungs. Other questions. Okay, so I find that the weight of my POC takes away from my effectiveness when I carry it around. Agree. What do you think about that, Ryan?
Yeah, that is the trade-off. That's why there are so many small form POCs. They trade off production capacity for a smaller size and weight. Because they do understand that anything above even 4 or 5 pounds is going to be a strain on a lot of oxygen users.
Sure.
So they're trying to find kind of this sweet spot of, all right, how much can we make, but also not make a device that is incredibly burdensome for somebody to tote around. And that is, when you look at the larger continuous flow concentrators, you'll see in their specifications they'll say 15 pounds, 16 pounds, whatever. But what they don't tell you is that you also have a power brick to carry around, a DC cord. Some of them have carts. You got a little bag. Any of the accessories that you have. So all of a sudden, your 15 or 16 pound device with a battery in it, when you add all of that stuff when you're traveling, it's up to 20 to 22 pounds for all of that stuff. So it certainly is understandable that a larger, portable concentrator is going to be a burden. So for those folks, it's, they also have decided, well, if I get a smaller device that can't produce enough, will I be able to use that device enough to make it worthwhile to purchase or buy? You don't want to buy a device that your needs are greater than what it can produce. Otherwise,
Absolutely.
It becomes an expensive doorstop. So
exactly.
That, and I don't see that changing anytime soon. I don't see a miraculous new technology, nanotechnology or anything like that coming soon that is going to change the way oxygen is taken from the air and delivered to the users. So if you need more oxygen than what the smaller, lighter ones can do, your options are either a larger portable concentrator, one of the cylinders. Sadly, it's not liquid. This would be a perfect situation for a liquid oxygen system. You have somebody who's 85 pounds walking around, you're carrying around a 20-pound oxygen concentrator. That's a quarter of your weight.
Right.
That's not really beneficial to them. It might give them a little exercise, which would probably be helpful, but it is so hard to tote that around with you for several hours a day.
That's where the mismatch.
It does put the users in a tough situation. And like I said, I wish we could give those folks liquid. They'd have a small, maybe 5-pound portable that could last them most of the day. So hopefully some common sense will eventually prevail here, and we'll be able to have that as an option again.
Don't bet on it, but the thing is, that's one of the frustrating things is really balancing the mismatch or overcoming the mismatch between supply and demand, because it's like, okay, you're now carrying this giant thing. Does that increased demand, does it outweigh the actual benefit from it? And particularly with patients who, I would say more so the interstitial lung disease patients, the patients with IPF, the pulmonary hypertension patients, they come in with their oxygen on and they're still in the 70s. So my point is, I would, not to say I don't want them on oxygen, of course, but that's obviously not meeting their need. And a lot of people are hesitant to make that move to a tank when they really need it.
Well, that type of situation raises a lot of questions too. It's like, okay, are you coming in blue and at 70 because you want to make sure your oxygen tank lasts all day? Is it that the device just simply can't give you enough, there are plenty of questions that come out of that. And with the variety of devices out there, you have to ask a lot of questions to figure out what exactly is going on as to why that person is coming in blue in the face and at a very low saturation.
Yep. All right, so here's a question from Linda. I've been on 1.5 liters continuous flow at home and 1 liter pulse dose with portable tank.
You can't say 1 liter pulse dose.
Right.
You can say it's at a setting of 1, but it is not 1 liter pulse dose.
Okay, so with 1 liter, setting of 1,
yes.
I get breathless. Can I raise it to 2, setting of 2 safely? I'm at stage 4, last PFT 40%, prior PFT 34%, struggling on the go. First of all, congratulations on your pulmonary function improving. That's awesome.
Yes, absolutely you can. You are free to change the settings on that device. I know some doctors out there might frown upon that statement or whatever, but the idea is you have an oxygen device that is capable of delivering you oxygen. It's not going to deliver you too much oxygen. If anything, this discussion has proven that most of these devices aren't delivering you enough. So if you are at a 1 and you have 4 or 5 settings above that, by all means, please, absolutely increase your setting. Understand that if you're on a portable concentrator, it might impact your battery life, but oxygenation is more important in this case. So if you are out and about and you've been using it at 1 and you have the ability to increase it, please do. And if you have an oximeter, track that so you can get a good idea of what settings you will want to use in the situations that you're using them in.
And if you have any questions about that, you think about the Untouchables quote: "Don't bring a knife to a gunfight." Okay, so if you need activity, go with the heavy gun that you have. Okay, turn it up as you need to, and rely on your instruments to tell you if you're okay or not.
Exactly.
Here's another question. So the weight of an M7 canister is hard on me. Would a battery POC be easier? I've heard of nightmares getting them serviced. Many make a sound like hamsters running on a wheel toy. And I'm going to only assume, I'm going to go out on a limb and say she doesn't like the sound of hamsters running on a wheel toy.
Sure. So on any concentrator, the sounds that are being made is the continual sound that I'm guessing is what she's referring to, the hamster sound, is the compressor that's running. So, and that is going to run all the time on a portable or even a stationary concentrator. So that's the noise that it puts out. So you can't get rid of that. That is always going to be there. And on a pulse device, you're also going to have the psh, psh, psh sound every time you breathe in. So depending on the volume, if you're breathing on a device that has a higher pulse setting, chances are that's going to make more noise than if you're at a lower setting. So if noise is an issue, you should understand that a concentrator is going to add a lot of noise. That's another advantage of liquid oxygen, is it's not going to make any noise at all, except for maybe the pulse sound. So,
if we're actually formulating a grassroots movement tonight, I think it's that we should push for liquid oxygen.
Yes, absolutely. I am on board.
Okay, so here's another question. Sorry, go for it.
What else? What was she on and considering changing to?
Okay, so she was saying that an M7 canister is hard on her. Would a battery POC be easier? And I guess we'd need to know about the oxygen requirements.
Yes, yeah. If she's on an M7, with a 6 liter, she'd probably go through that pretty quick. But if that was the case, a portable, especially one of the smaller ones, probably isn't going to meet that need. So I think we've had a couple questions here now. I would say it is always helpful that when you're asking these type of questions to say, this is what I'm on at rest, this is what I'm on at activity.
Right.
If you know what the device you're using is, at home and your portable device, all that information is very helpful.
It's crucial, yeah.
Like me trying to help out.
Unfortunately, because we're not live now, some of these questions have already been posted, but hopefully I'll try to sort of translate that as best I can if possible. Okay, here's one from Joni. Here's one from Robin. If you have to wear oxygen while sleeping with your sats falling into the 70s, Do you feel it's possible that you need O2 on exertion?
Those are two different situations. So the only real way to know is to have that evaluated.
Sleep study or overnight oxygen
Yep,
study.
yep,
Okay, I
yep.
agree. I agree. Yep. Or actually, you probably have had the sleep or overnight, so we need to assess you during activity.
Yes, yes.
Okay,
And
question.
is the DSAT associated with apnea or hypopnea or any of the sleep disorders? If you eliminate that, do your SATs go up? So I am a CPAP user. So when we have a sleep lab here, so I had a test done, and my SATs were dropping into the 80s. So that was enough to finally convince me that I should use CPAP. I don't need oxygen otherwise. So, and once I started using CPAP, my SATs are fine. So that was a case where it wasn't a need for oxygen at all. It was a need to treat the sleep disorder. So
did it change the way you feel since you started using the CPAP? How's it?
Absolutely. For me, my biggest challenge was finding a interface that I've tried. I'm lucky enough here to be able to try a lot of different equipment that a lot of people probably aren't able to do and see what's out there. And despite that, it took me, I knew I needed CPAP for probably 2 or 3 years, and it took doing one of our studies here and seeing that. I was like, all right, I actually have to do something about this. And so I just started trying different things. And if you are somebody who thinks they need CPAP or just starting CPAP and are kind of having trouble acclimating to it, the best advice I can give you is you don't need to, I guess, just be patient. You will get used to it eventually. If you come home on the first day and you try on your interface and mask and your blower and you can't do it for more than 10 minutes, that's fine. Put it aside. Try it again the next night. You might be able to last longer. The biggest challenge is getting acclimated to it.
Yep.
And once you do, it is so much easier to get into the habit of using it every night. So once I found that interface that I was comfortable with, really it did change a lot of things. I wasn't dreaming for the longest time. I'm having a lot more dreams. And I didn't associate that with having a sleep disorder. I just thought I wasn't dreaming or whatever. But when I look at it in hindsight, I wasn't dreaming because I wasn't getting any REM sleep. So I wasn't doing myself any favors. So again, as someone who's kind of been through it, I can't stress enough that if you think you have a sleep disorder, have it evaluated. And if you are somebody who is just getting into CPAP, stick with it. If you need to try several different types of interfaces, they are all different. They all fit very differently. They're all, each person has a different shaped face and everything. Try and seek out what you can and find something that works for you.
Ryan, if you have any access to nitrous oxide delivery devices, please send them my way.
Okay, will do.
So here's another question. I've been on 2 liters of oxygen for over 2 years, and my SATs went down to 84 in a sleep study for at least 10 minutes, but they say that was due to episodes of sleep apnea. So that's what we're talking about, essentially. They want me to be on a CPAP and take away my oxygen. They say this is a Medicare rule. Now, I have not heard that. Have you?
I can't say that I've heard that at all either. And there are plenty of oxygen users that have CPAP and use CPAP. So that really doesn't make sense to me. I certainly would question that unless, there have been Medicare changes and whatever, and I might not be up to date on that stuff. But
that one doesn't even make sense, though.
Make any sense
exactly,
to me.
Exactly.
If you're on oxygen, you must have demonstrated at some point that you needed it, especially during the day, I would guess.
Yeah.
So if you're desatting at night and you are still on your oxygen while you're doing that, certainly the apneic or hypopneic events, your sleep disorder, if you're not breathing, none of that oxygen is getting in. So you're going to desat.
Yep.
So to me, the answer should be, let's put you on CPAP with your oxygen and see what happens.
Right.
Because you can, if you just need continuous flow. It taps right into the tubing. So it is not, it is not impossible to use both at the same time. That's for sure.
Yeah, so she adds to that by saying the most I could wear it was 4 hours per night, and then I would switch to just my oxygen, and I would have my deep and sleep and dream, etc. With just oxygen, my SATs never went down below 90 on an overnight pulse ox test. Any suggestions? I would just say, you know what? A lot of times...
She's
I'm sorry,
she's on CPAP and desatting, but not when she's on just her regular oxygen?
Okay, so I think the issue is I have tried a CPAP in the past and had a lot of difficulty wearing because of back problems, and the pressure from the CPAP aggravated a cornea injury. The most I could wear it was 4 hours, and then I would switch to just my oxygen. So maybe they don't want her to have CPAP and oxygen for night. Although the device is the device. Once you have the concentrator, why not? I think we should clarify this, and I think if any questions, maybe call Medicare themselves and talk this over.
That specific part of that question, that doesn't make sense to me at all. So I'm not sure where that's coming from.
And I don't want to, really disparage anybody, but I do know that, sometimes, the companies are really trying to make ends meet now, and, again, I'm not pointing any fingers. I'm not saying, but I'm just saying, trust but verify. In the words of Ronald Reagan, trust but verify.
Yeah, I think you bring up a good point. With the current economic environment, a lot of it due to Medicare cuts that have been implemented over the last 10 years or so, providers are incentivized to sell certain things and whatever. And that's the business model. What that typically does is limit the options that are available to you, and you can bet that they are still, they're trying to make money, so they want to be able to provide you with equipment that is going to make them money. So, like
Sure.
you said, you don't not trust them, but verify. Do some research on your own. Just don't blindly go in and say, yes, please give me whatever it is that you're going to give me, and let me go on my way. I try and suggest to anyone really, be your own advocate.
Yeah.
And especially if you have a support system.
Or go in the groups.
Advocates.
Or go in the groups. I mean, efforts, pulmonary paper. Ours, shameless plug coming. Ultimate Pulmonary Wellness Facebook group. Ask the question, because people, there's so many times where you've got to find somebody who's used it and hear from others' experience as well. It's just a shame that we have to think like that. With the finances really affect all ends of the medical care.
They do, and again, like you, I'm not trying to disparage anything. We're in a situation. It is what it is right now. You need to be aware that you might not be given the best options for you, or presented the best options for you. And really, it needs to be taken upon yourself and your family to explore more of that. And a lot of the time, we've been talking a lot about equipment. A lot of the time, the people that are providing that equipment don't know anything about the equipment. They are providers. They aren't necessarily knowledgeable on the different aspects of all of these devices.
Right.
So, that's another area where educating yourself and being an advocate for yourself is vastly important, especially in this environment that we have.
Absolutely. And after all, it's not like we're talking about, a dishwashing detergent or something like that. We're talking about oxygen. It doesn't get more basic than that.
Bob likes to talk about oxygen is a drug. Let's think about this. Oxygen is a drug. It is classified as a drug, but it is probably the least regulated drug out there. There are regulations to it, but nobody understands that all of these portable concentrators do anything different. If you had 5 different types of a certain drug type, and they all did 5 very different things, guess what? They're probably not going to be prescribed, and there's going to be question. All right, why isn't this doing what it's supposed to be doing, or what you think it should be doing? With oxygen, there's no attention paid to the delivery side. In the hospital, we talk about, in the hospital setting, oxygen comes out of the wall. There are no devices
Right.
really in a hospital setting, and that's where a lot of people are, prescribed oxygen, and then they're sent home where they're given a provider who, drops off some equipment, and they're lucky if they get any education at this point on it. There is a huge disconnect between what happens in the hospital and what actually happens in the home. So I think that's where folks like us, try and come in and say, hey, you know, there's some stuff going on here that you need to pay attention to.
Right.
And
Right.
oxygen especially, really could benefit from people paying attention to what is actually happening here, because it really isn't on a higher level.
It's not common sense either. It's not common
No.
sense. All right, Jack, I have a Philips Respironics Simply Go and would appreciate your overview. I think that's one of the ones that you said you really like, right?
You have your continuous flow capable concentrators. That is the smallest continuous flow capable concentrator. And if anything, Dr. Tom Petty, very, very well respected researcher and founder of a whole lot of things in the respiratory care field. A long time ago, he said the ideal oxygen device for most people would be something that is 10 pounds, lasts 4 hours, and can deliver 2 liters a minute. The Respironics Simply Go is probably the closest device that we have to that. It doesn't quite last 4 hours, so that's the limitation there, is the battery life. And for a lot of these portable concentrators, battery life is a very limiting factor. So in terms of Tom Petty's vision, that is the device that comes closest.
Very interesting.
That doesn't necessarily mean it's going to be good for everybody, but as far as what he was seeing, that is the device that he kind of envisioned. It has 0.5 to 2 liters a minute of continuous flow. It has 6 pulse settings. It also has what they call a night mode or a sleep mode. I don't remember if it's night or sleep, but that is a different pulse option available that is intended to be used at night. So, we talked about not using a pulse device at night, but this one, if you're going to do that, this one at least, what it does is it changes its flow shape for each setting. So if you're at a 3 on the active pulse, it has a higher peak flow and a shorter duration. In the night mode, it actually, because they assume that you're going to be breathing at a slower rate and shallower, they lower the peak flow and increase the delivery time, so that it's more comfortable, makes less noise. So that is one of the few of the devices that has some sort of nocturnal or night or sleep mode that patients might find useful, especially during travel if they want to use a pulse device at night. But to me, it's, if you have it and you are sleeping on it, you have the capability of sleeping on the 2 liter a minute continuous flow that's always going to be delivered. So if you are able to plug it in, that's what you would do. I mean, if you're in a situation where you're sleeping and you're away from a power source, then yeah, the night mode, might be good for you. But I certainly would suggest, if you're sleeping on it, use it in the continuous flow mode.
Roxlyn says she feels that the sequel Equinox is amazing. Now, besides being 14 pounds, what do you think about that bad boy?
So the sequel Equinox and the sequel Eclipse, they're up to the Eclipse 5 now. As far as their oxygen delivery and characteristics go, those are the exact same device. The difference is the Equinox is about 2/3 the size of that and weighs about 5 pounds less. What they sacrificed when they went from the Eclipse to the Equinox is the battery life. So you have I think it's a 16-cell battery standard on a sequel Eclipse 5. If you go to the Equinox, the battery that comes out on the front is about half that. So part of their engineering to get a smaller 3 liter continuous flow device was to eliminate some of the battery life. And as of now, I still believe that is the most expensive portable concentrator. So they basically put the Eclipse 5 in the Equinox device, got rid of half the battery life, and charged more for it. And that's fine. It is certainly the smallest and lightest continuous flow, or 3 liter per minute continuous flow concentrator. It does the exact same things as far as delivery goes, has the exact same options for settings, sensitivity, the flow shape. I'm not sure how many people use that stuff, but they do have, it is quite robust in some of the different things that you can do. So in that sense, if, that's great. If Roxalin loves it, great. Other people might love it too. But if you're looking for a better value and you can handle the extra, 4 to 5 pounds that might come with the Eclipse, you could get that one for cheaper and get double the battery life, and you're getting the same device.
Gotcha.
So,
is there a POC with 4 to 4.5 liters continuous? Nope. What's the max continuous?
3 liters per minute. So that's the Eclipse. That's the OxLife Independence. The Invacare Solo 2. And the DeVilbiss iGo.
Gotcha. And again, don't feel that...
All 3 of those go to 3 liters a minute continuous flow. There is currently nothing available that goes any higher than that.
And again, don't feel the need to memorize that, people, because I will be providing you with a link to Ryan's review in the pulmonary paper. Okay, a couple more questions. How often should tubing really be changed?
I'd have no problem changing it every, even 30 days.
Interesting.
I'm not sure. What do you recommend? Or what is I don't even know what the standard recommendation is, but as far as I'm concerned, that thing's going in your nose, and if you're using it quite a bit, your extended tubing, if you have 25 or 50 foot extension tubing, I would say you can replace that less. But if you're using a cannula, I guess it depends on your costs. I don't know.
I think it depends on environment, and I think it depends how clean you keep it. I think it's important to kind of, we talk about infection control a lot and prevention of infection, and how everything you touch is a potential, for some bacteria or virus to enter your system, especially this year. I'd say you'll prolong its life and its safety for you if you wipe it down with like some type of antibacterial wipe, at the end of each day. Or when you come in.
At the very least, the part that, touches your face and whatever. The tubing part, you probably don't need to worry about. The innards aren't most likely aren't going to, suffer any sort of infection or whatever. But, if you, especially this part around here, if you can clean it, certainly do that.
Right.
I guess I'm not sure what the cost of, cannulas are to users. So, that's probably a factor. And like you said, the environment, a more humid environment, that might, be more impactful as far as, being able to carry infections and that type of stuff. I guess I would say, if you think it should be changed, then change it.
That's right. I agree. That's a good point. If some doesn't seem right, it's probably not. All right. If my rehab team checks oxygen after activity, should I tell them to check it during? That's a whole different story, but I'd say yes. Again, if you want to know how a plane performs in the air, you have to test it in the air. Doesn't matter what it does before takeoff or after landing. So when it comes to exercise, you should be checking during exercise, particularly at the peak.
I would also recommend, if you know you're going to be exercising or getting up or walking around, turn your setting up before you do that. Give yourself 30 seconds, a minute of turning up the oxygen before you go and do that. So you can give yourself more, because it's a lot easier to maintain than it is to dip and then come back up.
Great suggestion right there. I almost said great saturation. You probably do have good saturation too. All right, if your sat goes down to 77 at night while you sleep, does that happen every night, or can it fluctuate from one night to the next? And why? And would that be why your overnight oxygen tests come out normal one time and abnormal the next?
That certainly could be a reason. I mean, you are going to sleep differently every night. Position can impact what happens when you're sleeping. Your sleep events, sleep disorder events are going to be different every night. There are a lot of factors that go into it. So certainly, if you have oxygen, or if you have a sleep test one night, I certainly could think that you would have very different results the next night. So I certainly wouldn't rule that out, but that would be something you would need to investigate further and understand. All right, what was different about this night than this night.
My only suggestion on that, also, just one point, is that to go down to 77% one night and then be completely normal the next night, like without having a cold or a sickness, I mean, that's a bit strange. That's like mistaking a goldfish for a shark in a way. I would.
My thought was that there's some sleep disorder breathing that is going on there. That's my first thought, anyway.
Yeah, for sure.
So
for sure.
if that was under a sleep, if they were actually having a sleep test, you would think that those results would be there. If this is just anecdotal based on a couple different nights, if they were testing on their own or something like that, I would say get a test, and they will tend to ask you to, even if it's not necessarily natural for you, they might try and get you to try different positions and whatever. So they may try and find out. If you go in there and say, I'm having these issues, they might try and find out why, and maybe try and put you in a position to do that.
Yeah. And I think I'd want a third test any way you slice it, because something's weird there. Okay, so do you know of any lightweight ones that go up to 5 liters per minute? We said no, for sure.
Let me stress again, I don't see that happening anytime soon. We might get something that can do 4 or 5 that's similar to the Equinox or the Eclipse, but as far as 5 liters per minute, continuous flow, portable oxygen concentrator, don't anticipate anything that's going to be the size of the smaller pulse devices that can have that capability anytime soon.
Right. Michelle asks, do I have to have a breathing test? When I have to have a breathing test done, or do I have to have a breathing test done where they shut off your oxygen, and for how long is the test? I wear oxygen 24/7. Let me just answer that quickly. If you need oxygen 24/7 and someone says, we're going to do a test where we're going to shut your oxygen for any prolonged period, run, okay? You turn your oxygen up and run, because it's unethical. It's like saying, I need this blood pressure medication, but no, you have to have on what your test, what your normal day is. Okay, Roxlyn again, as of now, no POC delivers 5 liters. They do, however, deliver a number 5 pulse, nowhere near 5 liters. Okay, good points. Again,
on that, there is a conserving regulator out there called the Smart Dose, and I think it's still distributed by Drive. So that'll be a pulse device that sits on top of one of your tanks, and they did have a liquid model at one point, but I don't think they do anymore. That actually, I have one here. So this is a Smart Dose device. What differentiates this from the other pulse conserving devices is that it tracks your breath rate. So when you're sitting down and you're breathing at 14 breaths a minute, it keeps track of that. And then when you get up and start being active, once you get above 18 breaths a minute, it actually, without you needing to change a setting, it increases the amount of oxygen that's being delivered to you. And then it does it again if it sees another increase of 4 breaths or more. So it has kind of, if you set this to 3 and you get up and walk around without changing it, when your breath rate increases, it actually increases the dose that it's giving you. So this is currently the only type of device that does that. So if this is interesting, to any of you out there, look this one up, because we have done some tests, and I think Drive might have put out some of that information in a white paper within the last year or so. But we did record that the FiO2 actually increased even when the breath rate increased. So this is really the only device that has that capability. So this is certainly a unique one out there.
And here's another question. Somebody got ripped off, was told that they had a continuous POC that went to 5 liters per minute continuous, and then got charged for a restocking fee. You heard it here tonight, and this is not conjecture here. This is real deal. If Ryan's saying there's nothing that goes above 3, there's nothing that goes above 3. Okay, he knows this stuff. All right, oxygen has irritated my nasal passages to the point where I have bloody noses. I see air gel sinuses run. Okay, I'm not okay, saline nasal mist. Is there anything else? Okay, you could try a mask. You could try the air. I love the air. I think that's terrific. Here's another question. I'm not sure if this has been covered. It has, but it comes up over and over again. How is it that some people can be on supplemental oxygen when their lung function is in the 50s and others who are in the 20s can still function without it?
Yeah, that's a question for you, really.
Yeah, I mean, I think that everybody's different. You know, when we talk a lot about, you know, the fact that breathing is multifactorial, and somebody could be in the 50s and have a lot of, you know, a lot of inflammation or airway mechanics that just make it difficult. They maintain their SATs,
Yeah.
but, you know, it could be a diffusion
Physiology
issue.
definitely could significantly impact what's going on. So.
Absolutely, absolutely. And here is the final question of the evening. And Ryan, I thank you for hanging in there for over 2 hours. This was terrific. Here's the final question, and then I'll praise you even more to high heaven. Okay, is using your pulse oximeter the only way to compare stationary concentrator percent of oxygen versus compressed cylinder? I run 4 liters per minute and oximizer for SAT of 96%. 4 liters per minute cylinder raises it to 97, 98, both at rest. I do check flow at distal end with flow meter each day and anytime I change flow, like for exercise. But biggest difference in SAT occurs with exercise or exertion. Cylinder at 5 works fine. Concentrator needs at least 5.5 to 6 for equal SAT. I know concentrator has percent range impurity and is less than 100%. I have a Millennium 10 liter and check the filter every 2 weeks. Will any stationary concentrator ever get to 98% purity? And the answer, Marie, is that if things don't work out for you, you have a job checking people's oxygen because you are doing a lot of work there. All right, so what do you think of that, Ryan?
I highly doubt there will be an oxygen concentrator that can produce 98%. I think the maximum is around 95.5, 96. And that might be even stretching it, just the nature of the, you know, again, the SIB beds that we talked about earlier, the capacity for them to separate out the gases and that type of stuff.
I think it defies physics, you know?
It kind of does. It is pretty amazing when you think about it. But yeah, certainly don't anticipate any sort of concentrator that can do 98%. And, you know, she said, I think at first it said oximeter. I'm guessing she means like an oxygen percentage meter. If they're in the 90s, they're operating within specification. The real concern should come if they get below 90. I would start getting concerned about you know, degradation of sieve or something else that might be going on. You know, the pressure could be offset or something like that. So if your concentrators are operating in the 90s and doing so consistently, they're operating to specifications and they're not really going to get any better than that. So they're working just fine.
And one other point I'll make about that is that, you know, if you're in the 90s, particularly the high 90s in oxygen saturation, there's not a major difference between 96%, 97%, 98%, you know, as evidenced by the oxygen hemoglobin dissociation curve, which is another thing which I'll make available to you. But don't worry. I mean, don't worry that you're only 96%. I mean, most people would, you know, would stab their neighbor for 96%.
There are plenty of healthy people whose regular saturations are in the 92 and 93 range. It's
exactly.
Not, you know, if you're in the 90s, you're doing fairly well, and
exactly.
You know, especially if you're doing it without oxygen.
Exactly.
So if you find yourself in the 90s and you're using some oxygen, you know, maybe lower the setting to see. You know, again, that's kind of, you know, if you're sitting at 2 liters a minute. And you could lower it to 1, especially if you're on something like a tank or whatever. You can do that. You know, I think we talked about that earlier, where you definitely have the option to change the setting on there.
Yeah.
And you should. You know, and especially given whatever environment that you're in. You know, a concentrator, you know, that's continuously running, so it's not really a big deal with that. But on a portable concentrator or a gas cylinder, where the portable concentrator will be limited by the battery, the gas cylinder will be limited by the contents. Anywhere you can, you know, try and save some of that oxygen. If you are in the 90s, you know, maybe turn it down a half setting and see how you do. If you stay at the same one, you know, go down another half step. and see if you can still oxygenate then. And again, log it. I can't stress enough the importance of logging the experiences that you're having, so you can kind of look at it and put together, what your oxygen needs are at the various different things that you might be doing.
Absolutely. Ryan, I really cannot thank you enough. I mean, like I said, I've been reading your stuff for so many years, but hearing you talk about it, it just sheds such a new light on these things. And, there's so much misunderstanding out there because these are complex topics. I mean, it's not as simple as ABC and 1, 2, 3. And, your knowledge of it is so in depth and so, really conveyable to people in a way that they understand. So I do really appreciate your time. We just went over the 2 hour and 5 minute mark, so I thank you for your patience. I know you're tired. I think there's just one more thing we should do in the interest of protecting both of us. I think we should show our forearm tat side to side.
Oh, I don't have as much as you do.
Right. I just want to be sure that if a crime is committed, and we're in the same spot, that they don't confuse you and me. So, Ryan,
might get to where you're at someday. I would like to get some sleeves, but that hasn't happened yet.
I thought you meant New York City, but if you ever come to New York City,
I would like to get there too. I've never been there.
You are welcome. I will put you up. Thank you so much for this. I know that my group thanks you so much for this, and I will be in touch. And everybody, this man is a walking brain of oxygen right there. Okay, so just remember, O plus O equals O2. Thank you so much, and have a great night.
Can I say if anybody wants to contact me, if you can put up, my email address or whatever, I'd be happy to answer questions and whatever.
Absolutely, that is a great blessing as well. Thank you so much, Ryan. If there's ever anything I could do for you, I am more than happy to do it. If your car falls into the water while you're ice fishing, I will do my best to get it out. And with that,
needed you this weekend then.
All right. Well, I didn't know in advance. I didn't know if this was going to be a good webinar or not. Now that I know, you got me. All right, ladies and gentlemen, thank you so much for tuning in, and I hope that you got as much out of this as I did. Have a great night.
Thank you.
I'm Lungman. Use your damn oxygen.